left pulmonary artery. Sorry, left pulmonary artery here. So when you're looking for that pulmonary artery, this is going to be your anterior. Okay. So pulmonary artery is going to be your anterior. Vena cava is going to be your posterior.
Okay.
Okay? Yeah. Okay. So, vena cava, posterior. So, let's see here. So your vena cava.
What did he say?
This one. Okay. See how I'm following it through? And you're...
Yeah, I didn't see it.
I was just seeing how you guys cut it, that's all. Give me 1 second. I think you guys cut some stuff off.
Really?
Just because how you cut it in half.
Okay.
Give me 1 second. No, there we go. Okay. Sorry, it took me a second.
But this is the anterior side, right?
So this is your right side. So this right here is going to be your vena cava. So this should be your vena cava should be your posterior. That should be your posterior side.
Okay. All right.
Okay. So posterior, anterior. Okay. I just had to see which ones were going where, because that's going to be your right atrium. Okay. So vena cava, posterior.
Okay.
So let's talk then. So what is this? That's the posterior what? Posterior interventricular. Yeah. You look here, posterior interventricular artery. So that's this big one going down. Okay. Now the other one I had you guys know was your right coronary artery. So we're finding this. We're talking about, see the sulcus here, how it goes right underneath? It's that one. So we're looking like right here.
All right.
Okay? And it's basically, it just looks like these indentations. You can see how they're flowing down, right?
Right.
Okay. Now, the other side. So we're talking about the pulmonary artery, right? So once again, we're taking that through, following it through out to the artery. Now, so what is this then? That was the posterior, so this is the anterior. So it's the exact same thing, but one side's the front, one side's the back. So what does anterior mean? Anterior means front, posterior means behind,
Right.
the back, okay? But it's super easy as long as you find your blood vessels.
This is easier to identify, huh?
Yeah, I always say find your, if you follow this through, find your blood vessels, you can see which side's the front, which side's the back. Okay? Alright, so, do you want to walk me through the actual blood flow? Do you guys feel comfortable with that yet?
No, can you explain it?
Yes, let me grab my another glove.
Thanks. Okay, yeah.
Oh.
Do you guys want to come over here and do it with us?
Well, we actually want to see it on our own because ours is cut kind of funny.
Ours is cut a lot better.
Alright, so if you guys want, just, we can just look at it together. It's up to you guys. Okay, so it's really easy to see what blood vessels you need to find when you're following it through the heart, right? So this is the what side?
It's the left.
Left?
Right.
Right.
Huh?
The
Right.
left and the right side. Well, the right side's going to go to what?
The right side is
Go to your lungs.
deoxygen.
It takes in the deoxygenated,
Yes.
right? So it's going to push it out to the lungs. So since it only has to go to the lungs, it doesn't have to be as thick.
Oh, gotcha.
Yeah, because this has to push it out to the rest
So
of the
ours
body.
is actually backwards.
Did you guys cut it weird?
No, the flat side is not always this side up. See what I mean?
Yeah, I'll just have to look at it in a second.
It's
So we're
backwards.
studying it backwards.
Okay. Yeah, it should be able to show you guys pretty well on the inside.
That longitudinal line
Yeah, it should
that
say,
we
yeah,
have.
the right. It should show it pretty well. All right, yeah, but your right side's going to be the thinner wall. Okay? So we're looking for the ventricles and the atrium, right? Now, you guys cut yours weird, didn't you?
Oh, I didn't know what
Kinda.
I was doing.
Okay, there we go. Okay. So this is going to be your right atrium. So, what blood vessel is going to correspond with the right atrium? So it's going to go from the tissues to what?
So, superior vena cava,
Vena cava.
Uh-huh. Good. So it's going to flow into what? The right what?
atrium.
Atrium. Okay. Now, it's going to pass through
Tricuspid.
what valve? Tricuspid valve.
valve.
Do you guys see that valve? It's that flap. Do you see that flap?
Oh, okay. All right.
Okay. And you guys see those strings attached to it?
Yes.
So sorry, guys. That's called the chordae tendineae. Okay, and the chordae tendineae are going to be attached to papillary muscles. This one isn't as big on this side, but you'll be able to see it bigger on this side, right here. Do you see that? It's like a big indentation. Okay. Now, and you see these ridges here in the atrium? Those are called your pectinate muscles. Pectinate. It should have it listed. It helps to, it's just where like your SA node. So you should have everything up there. But yeah, you should have your pectinate. It has it listed. Okay, good. All right. So you're going to go blood from vena cava, right, into the right atrium. Pass through the tricuspid valve, pulled shut by this chordae tendineae. You should be able to see them. They look like heartstrings, right? And then it's going to go into the right what?
Ventricle.
Ventricle. Okay. And just how they have it cut. So it's cut like this, a little bit weird. So you can kind of see where the valves were. So you're then going to take your finger and you're going to follow it through. And what's it going to come out through? What's it pushing out the blood to? The pulmonary artery. Because remember, veins are going to, arteries away. Okay? All right, so what valve, though, is it passing through?
Pulmonary.
Semilunar.
Semilunar valve.
Yes.
Yeah.
Okay. Now, it's going to go to the lungs. It's going to get oxygenated. Then it's going to come back in through what?
Pulmonary veins.
Yeah, and I think you guys...
It's hard to locate the
That should be for your aorta right here. That's where your aorta should be.
it's hard to
It's just how you cut it. It's just how you cut it.
Pulmonary vein is right here. Isn't that the pulmonary vein right here?
Let's see here. What, where they cut?
No.
That's the auricle right here.
See? Auricle. What does the auricle do?
It's the flaps that
It's a
cover...
balloon
Expands
vein.
and contracts.
Yeah, see?
Yeah. Yeah,
Trying to
okay.
explain that to me.
You're
yesterday
fine.
When we were studying.
No, that's the auricle right there. Now, okay, let's see. It's just how you got it cut in half. Give me a second. Right, left.
Practical
On hearts.
on a model or
Are you gonna bring the real?
Yeah, I'm gonna have them cut open for you.
Next Monday?
It's hard. It's
Oh
cold.
no, it's like in February.
Do you have a
I have
pop quiz on Monday?
Maybe.
It's hard to.
What are we doing next week? Are we doing respiratory? I have to look on my schedule.
There was something.
So that should be where your aorta is. This right here is your left. So this should be your pulmonary vein.
Okay.
Okay, the pulmonary vein is going to go into the left what?
Left
Atrium.
It's going to pass through which valve?
Bicuspid.
Bicuspid.
AV though.
It's bicuspid, right? So the mitral.
Oh,
Mitral.
bicuspid, mitral.
Yeah.
But AV is on the other
AV
side.
is the tricuspid.
And then it's going to flow into what?
Left ventricle.
Where's your... It's just how
That
you,
side
this,
messes
I think
me up because
this is where it was. Okay. I was just looking to see where the valve
So
was
we're gonna
at.
have this phenomenal heart to be able to find all these
I'm
locations
gonna
on this
cut them
practical.
for you guys. I'm gonna cut them for you guys.
Are you going to show that side?
Are we gonna be
or
able to
this side?
study
This
from
is the
that
side
heart?
I want to see.
I'm gonna have probes sticking in through the blood vessels. You should be able to see, oh, this is the right side. This is the left side. You should be able to tell that automatically. But if you can then
I
follow,
gotta flip it in my brain.
do you see how you can follow that? And then I'll have like a probe sticking through here, for example. So, and you can see, okay, it's the upper side
So
of
it's
the
an
right.
aorta.
Well,
It's
that
an
we're,
atrium. It's an atrium.
well, we're talking about the right side of the heart.
That's the right
That's gonna be
atria
the
to
superior
the
vena cava.
superior vena cava, right?
Yes, the vena cava. Because that's the thing, because we're talking about from the tissues. So if it's right side, it's coming from the tissues.
It
It's
looks
pumping
like
out.
part of the ventricle though, because I didn't see the valve.
Oh yeah. Because the valves, how the
That's
valves
what I'm
are
hearing. Is identifying the right ventricle. Where does it start? Where does
right
it
here.
end? Okay.
So basically, you're looking in between the valves. Do you see those valves? Like there's the valve right there.
Okay, that's the valve.
Yeah. So atria, ventricles.
Okay.
Yeah, it's the valves that separate it. Okay.
Okay, the problem that I have is when you get to the left side, it
Okay.
looks like you have
It's
a lot
'cause-
of openings.
Right.
So how do you
Because
tell which is which?
it's how you follow it. So basically, it actually branches, and you'll get to like the left subclavian and the right subclavian. But
Does
the
the
way
sheep's heart have that?
yes, but now the thing is though, you
couldn't
should
see it.
actually be able to cut it off.
Because I only see
These are
one.
cut. These are cut very, very like to the heart.
Right.
So a lot of those branchings you can't see. Yeah, but whenever we get to the cat, you'll like, and we'll talk a little bit about what the cat has and what the cat doesn't have compared to what we have. But there's some things you should be able to see.
Okay.
Okay. But whenever we get to the cat, there are a lot of things you'll be able to see. But basically, with this, that's the reason I want you to know the main blood vessels because how they cut it.
But with the cat, the veins and arteries are dyed though, right? They're filled with
Yes,
latex?
they're dyed.
Okay, okay.
Yeah, they the veins
Ones
should be
are
filled with blue, and the arteries should be filled with red.
Yeah, usually.
This should be. And I believe, yes. I have to check, but I'm pretty sure that I ordered dyed ones. If I didn't get dyed ones, I'm very upset. Because people have trouble seeing that
Well,
if they don't.
if not, I have my cat at home, so
Is yours dyed?
I hope so. Because
Yeah.
you order a cat in a box and they send you what you
That's true.
tell them you need. So I hope it's dyed.
That's true. Well,
It's done.
okay, so
Yeah, it would have. I would have.
it will be.
Moving on. I need to learn here.
Okay,
Yeah.
so now where were we at? I'm sorry, I lost track.
here.
We're looking for the
Left
arteries
ventricle.
and the vein.
Okay, we were talking about the difference between the ventricles and the atria, being able to see them, right? So basically, when you're looking for them, make sure you can pull it
You're
apart.
looking for the tendon.
You're looking for those flaps. Do you see that? Mm-hmm. And I'm going to try to have them set up very nicely so where you can see it. Like, I'm going to dissect them out for you.
like for the practical.
Yeah, for the practical. I don't want to give you guys ones that other students have dissected because sometimes people cut things a little weird and they cut things off.
Yeah.
Like this right here, see how that was, it's supposed to go around because that was to the aorta? Yeah, see how that's, yeah, so that's the reason, like, some things are just cut weird, but you can see it whenever I hold it together. Whoops.
But we won't be able to touch it.
You're fine, it happens. Huh?
We won't be able to have our glove and touch it.
If you need to, you can. Yeah. Okay, so, from the tissues to what?
To the from the tissue.
From the tissues. So we want it to become oxygenated. So we know it wants to go to the right side. So, so
superior
your vena
vena
cava.
cava.
Okay. So that means we need to go to the right side. So we're looking for
It didn't go
how.
out the aorta yet, did it?
Yeah, well, I sort of started all over.
Oh, okay.
Yeah, just so because I lost track of my thoughts. Sorry, guys.
Once again, you said the right, it'll be distinctively smaller and thinner because it's lower pressure.
Right, because it's only pumping it to.
It's only receiving.
Yeah, it's receiving here. Well, both of the atriums are only receiving.
Right.
The ventricles are your
But
discharging
this
chambers.
is where it needs its power
Yeah, because this is pushing it to the rest of the
to
body.
the body, to the aortic
Yes.
arch.
So here, the vena cava. See how the vena cava? Like right there.
She is in the right atria right now,
Uh huh.
to the superior vena cava.
Uh huh. And you guys can see where I'm at. 'Cause you can see that that flap there, right? That valve. Okay. All right. So you're going in through here, in, and you guys can see those